Welcome. Hi, everyone. Thank you for joining us for our Ask Better, Get Better AI tools for your health journey. I'm Ivelisse or Ivelisse Andino, founder and CEO of Radical Health, and I am thrilled to be with you today. This workshop is a special one, largely because some of us are a little intimidated by AI, some of us love it. And in particular, it was really important that we work together to figure out how do we use this for our health? How do we take advantage of the tools, learn more, maybe address some of the fears that we have, and think about this maybe a little differently than we have, or learn something else around specifically AI and health. So, for those of you new, Radical Health, we believe you don't have to health alone. We build community-centered care through peer-led conversations that are culturally grounded, provide navigation support and training that equips healthcare workers to serve with the trust, the skill, and less burnout. Our work really started because we knew that times are hard and things are scary and really want to make a space that uses community plus technology. So I'm going to tell you a little bit about Jasmine. Um, and there were many other people like Jasmine that I spoke with in advance of this workshop. So Jasmine is 34 years old, works a full-time job, has two kids, and started having chest pain. She did what anyone in their right mind would do, which is at 2 a.m. Googled chest pain. And of course, after about 15 minutes, then the 30 minutes, and especially the hour after Googling all of these things, she was convinced that she had six different diseases, was petrified, didn't really know what was going to happen, didn't know if she should go to the ER, didn't know. Basically, this was the end of the road for her. And I'm curious if that sounds familiar. You start with what might be something small, and then just a few hours into the Googling process, you're at a different place. Here's the thing, and I want to name this: Jasmine isn't wrong, right? For looking for information. She wasn't wrong for even Googling and being curious about what was going on. I think that what happens sometimes is that things can get overwhelming. Things can be scary. And for Jasmine, we wish and would hope that she had the right supports, not to just go down an empty rabbit hole, but really to use AI, the internet, any tool, right, as a tool that would support her, that would help her organize her symptoms, understand what's happening, help her decide and help her know in advance what is an emergency and what to do, and then give her what she needs so that it's not a panic. And so, what we know at Radical Health is that oftentimes healthcare is scary, it's lonely, and it's hard to figure out. So, I'm curious if anyone in the chat wants to jump in. This is your shot. Have you ever Googled symptoms and ended up more confused, more scared than when you started? I know I've been there for sure. I want to note that, one, this isn't your typical healthcare workshop. Today, we're going to spend our time figuring things out. If you are here with us live, we invite you to chat and chime in. If you are watching this on a broadcast or a recording, we still want you to engage and to participate. We're going to spend some time today figuring out how to translate confusing medical terms, how to prep for questions and before your appointment, how to track symptoms so that you can communicate well with your provider, whoever they are, and how to research treatments without spiraling like Jasmine did, or like I've done many, many, many times. And then we're going to help you figure out how to decode medical bills. Sometimes that's really scary, figuring out how to pay for things. So before we start, we're going to talk about algorithms. And this is before we start about AI. There are a lot of questions around that. We're going to think about everything like an algorithm. An algorithm, I like to just say, is a fancy word for a recipe or instructions. So for instance, if we look at like an input, those are your ingredients. The process is the instructions if you were making a cake, let's say, right? How, what do you do? What steps to follow? And then the output is what you get at the end. So for example, if we're making toast, the input would be a piece of bread. We'd put that into the toaster, which is the process. You set a timer, press start, and then the output is some nice golden brown toast. We use algorithms all day. Our phones use algorithms, your GPS, right? Figure it out. Um, AI just happens to be a smart algorithm that learns from other examples. So we're going to talk a little bit about our health algorithm. I want you to think about the last time you didn't feel well, or maybe you were with someone who didn't feel well. What was your decision-making process? I'll give you a few seconds to think about that. What were you feeling? What were your symptoms? What do you consider? And then what did you do after that? Did you go to a doctor? Did you rest? Did you Google? Did you use a tool? So think about your algorithms, and just I want you to note that everyone is going to have a different algorithm, right? Because algorithms are really reflecting opinions. So I was feeling chest pain, right? What did I do? What am I considering? I'm considering that it's the middle of the night. Or if we're thinking about Jasmine, right? She has kids at home. She cannot go to the emergency room right now. So really prioritizing time, effectiveness. And then the output was, let's just research more. But everyone's going to have a different algorithm because really the algorithms that we're using, we're going to reflect different opinions about what matters the most. So sometimes we're prioritizing cost, sometimes it's time, sometimes we're going to prioritize better be safe, right, than sorry. That's usually my anxiety of like, let's just double check. But I want you to keep this process in mind because we're going to revisit it in just a few. All right. So what is AI? I'm curious here. How do we feel about AI? Do we like it? Are we afraid of it? What's bringing you here? Are we like, what is this AI? So please answer in the chat. Okay. Alexis, AI is their BFF. I have a friend who calls it chat bestie. Katarina loves it and is afraid of it. Rightfully so. So AI is a special algorithm, which we just talked about, that learns. Think about teaching a kid their colors. You show them an example. This is an apple, it's red. A fire truck is red. The stop sign is red. Eventually, you learn what red is. AI works the same way, right? You feed it examples, data sets, what you want it to learn. It finds patterns, and that's how it actually learns. And then it makes predictions about what things it sees. To note, ChatGPT, which we'll talk about, maybe that's the one that we probably hear the most about. It learned by reading millions, all the websites, the books, conversations. That's another conversation about how it learned, but really it learned, and that was the data set that it learned on. So when we're asking it a question, it's predicting what should come next based on all the examples that it learned from before. When we think about the three parts of AI, I just want to name these, right? That data set. What are we learning, right? It's teaching a baby. This is what this is. These are the things. And then it's figuring out, it's learning along the way, and then it gives you an output so that when it sees a picture of something with 4 legs and a tail and fur, it's like, oh, that's a dog. And as we're learning about AI, we also want to just name that AI has an environmental cost. So the way that it does this learning is that there are data centers, a lot of machines involved. Every question that we ask ChatGPT uses energy, a lot of energy. And we want to just name that this comes with an environmental impact. The data centers that house all the computers and chips, they run 24/7. They need electricity. They need water to cool the centers. So a lot of water, a lot of emissions. And it's really important that we just name this because climate change is real, it's present, and it is a health issue. And so we would be remiss if we didn't name the way that these things come full impact. A lot of the folks that when we were prepping this workshop, we talked with, right, some folks are hesitant because of the environmental impact. And so it's just want to name that as we're learning about AI, how it works, we really need to name that there is an environmental impact here. And so what we want to offer is, think about AI intentionally, how we use it. Don't use it for things that are, silly. Some people say don't say thank you. I like to be nice to the machines because you never know. Joking, that was a joke. But think of it as like, driving a car. You wouldn't drive around the block, 10 times for fun, but you would absolutely use it to run an errand. You might use your tool in a wise way. So we just want to offer that as we're using AI and we're talking about it and we're learning about it, we use it wisely and use it when it matters. Great. Other things to note, and we're going to jump into all the AI things, but these are all the heads up, is that AI is not perfect. It is best. I know sometimes we call these chat besties. I like to think of AI as like, a little puppy sometimes or something behind the screen. It's very helpful, but it does make mistakes. And so before we start talking or using AI, you need to know that hallucinations, it will confidently tell you that things are true and absolutely right, but it is made up. So it might give you a fact, but it not cite where that fact came. So you always want to double check. The other thing is that AI is learning. We talked about how it learned on other models and conversations. And so it's also important to note that stuff might be outdated. It was, trained on things beforehand. Things have been updated. So really, it doesn't know what happened as soon as yesterday. So sometimes the data you get back might be dated. And then bias. This is a big one. We really care about it here at Radical Health, but this makes a big difference in that AI is trained mostly on data from white male bodies. So if you are Black, brown, older, if you are not represented in that full picture, the info that's here might not fully apply to you. So when we think about using AI, this is an assistant. It is your research assistant. It is not your doctor. It is not, a definitive answer. Think of it as like an opinion or something else to maybe consider. If it doesn't feel right, it is not right. If your body says, then listen to the no. Chat with someone else, get other resources, but think of this as like a book in your library that has an opinion that you might consider and you might not, and that it can make mistakes. So again, think of like a puppy or like, however you think about someone who you can make it as not as a real person, but just something that is helpful that gives you an opinion. And want to always name that you always want to verify with like real humans when we're talking about AI. So remember your health algorithm and the recipes that we made. And everyone has a different health algorithm. AI algorithms are the same. They have opinions baked in. So ChatGPT, right? They want you engaged, so you keep using it. But when you set your prompt or you set what you're looking for, you set the goal. So this is where it's important, and we'll talk about how to use these tools for your health, but you're going to determine and you're going to tell the AI interface that you're using how you want it to work, because this is your health. It is your health algorithm that you're going to create. So when you get to write a prompt, right, you're going to set the end goal. So you get to say, I don't want to be entertained. I want clear. I want simple information. You can set your language. If you speak in Spanglish or Korean, you can set that and you can tell the GPT to give you what you want. And that's the power of prompting. And we're going to do a lot of prompting today. But you're telling the AI whose opinion matters. And that's your opinion. So when you use AI, you get to set your goal. And let's get started. Are you ready? All right. So can someone in the chat tell me tools that they like when they think of AI? Maybe tools that they like to use. What are they called? Maybe things that you've heard of that you're curious about. But which ones, for those of you who said that AI is your bestie, your chat bestie, what are you using? Which tools are you using? ChatGPT, Gemini. Cool. ChatGPT, of course. Oh, no question. Okay, cool. There are so many tools. I'm going to just talk about two today. I'm not paid by these folks. This is not an endorsement. But we're going to talk about the two kind of maybe more popular ones, and we'll just show them both. Ones that maybe you might have heard of. Claude is one that's not as popular, but it's by Anthropic. The website is Claude AI. It's really good for like longer responses. It can follow really complex instructions, works with PDF. You can get there's a free version and a paid version. Has longer conversations when you pay for it. And then we have ChatGPT, as you all mentioned. That's by Open. We have Gemini, which is another one. There are so many different versions, and they all kind of, each of the biggies, all create their own. But ChatGPT, good for most questions. Sometimes it can be busy on the free version. And then there's also a paid version that can analyze images, PDFs, so on and so forth. Again, just want to name that this is not an endorsement for any of these, but these are some of the types that we might hear. And so we talked about ChatGPT, and let's see if this works the way I thought it would work. We have a window to share with you what these look like. And it's important that when using ChatGPT, we talked about your health algorithm, you're going to tell it what you want. This is what ChatGPT looks like. I want to name that when we do one thing that you can do when creating a profile is make a project. So I was here and I created a new project called Health, but this is what it could look like. And in Claude, we have a bunch of chats and you can do the same thing. You can make a project. What we'll do here is we're going to use the prompt from our chat and we're going to let me go back to that slide actually. Technical difficulties here. There we go. We're going to tell the chat GPT what we want. Both of the tools, any tool that you use, right, lets you add personal context so you don't have to repeat yourself every single time. You can add an age range. You can add general health interests. This is really important. You can add languages. So this is really important. Let's say English is not your first language or you want to understand things differently. That's really helpful. And then you can tell it how you want your answers. So sometimes you might want bullets. You might want detailed. I like long paragraphs. You want it to tell you things like it would in the story of Zelda, right? Or Super Mario Brothers. You can tell it how you want things and it will do that for you. I want to name, and we'll go through this a little bit later. You do not want to add specific things, any you can add medication names, but I would not add your personal name and medication names. I would take out doctor names, so Dr. X, Y, Z. Take out anything that's like super personable, anything that can be identifiable. So don't put your address, don't put your phone number, any of those things you do not want to add in. So when we think about an example here, I might say I'm in my 40s, I speak Puerto Rican Spanglish, and I'm interested in heart health and nutrition, and I prefer simple explanations without medical jargon. And we can see if we can try this here. Nope, it's not going to work. Okay, so I am in my 40s and speak Spanglish. And so if you have a ChatGPT or anything that you're using, feel free to set yours up in the same way. We can do it at the same time. You're also going to get a chat today with all of these things in here. In health, sorry, I should have copied this. Okay, and when we enter that in, we're in a health project. So everything that we do in here is going to be about our health. Our chat bestie is going to come back eventually with updating our memory, right? And this you can always update or change. And this is where we're going to teach it, right? This is how they're going to work with us. If things change, I don't want to speak Spanglish anymore. I want to speak Korean. We can change it here and manage. And so thank you for sharing that. And they're going to tailor this in this way. All right. So we're going to do our first prompt for the day. Have any of you been to a doctor's office and they said something that you did not understand? If your doctor said your A1C is 6.1, which indicates pre-diabetes with some insulin resistance. Has that happened before? Yeah, sometimes. What we like to do here and the prompt that we're going to offer is how do we understand when somebody says something to us that's really complicated? The best way to do this is a prompt that we'll share with you, which is like translate. When you're using or when you have words that are confusing, right? You will tell your ChatGPT, I am blank with a gender if that's relevant. If it's not relevant, do not include it. With the condition, again, if relevant. You've already told your ChatGPT how to talk to you, so it's going to know. But then you're going to say, my doctor said blank, blank, blank. Explain it to me like you're my friend, not a textbook. Then give me 3 questions I should ask at my next appointment. If it makes sense to add your ethnicity, add that. If not, do not. And that's just, you only want to give the information that you need to. So let's try that here. And just for fun, I made these already. So we'll just kind of copy and paste this in here. So I'm a 52-year-old Black woman. My doctor said your A1C is 6.1. Explain this to me like you're my friend and not a textbook. And then give me 3 questions. This is going to be in Spanglish now, but here we are. What your doctor basically said. An A1C of 6.1 means that my sugar has been running a little high for a few months. It's not diabetes, but your body is saying, hey, sis, pay attention. My ChatGPT really knows me. What it doesn't mean, why this matters, and then 3 questions to ask your doctor. What small changes would I make? Can we check my vitamin D and kidney markers? What I would often add is that you'll get some recommendations, and then it's worth researching these further. Hey, can we check my vitamin D? Does that make sense, right? And you can spend some time asking and having a conversation. They'll also make, a plan for you. Let's go to another example. Any questions on this one? All right, prompt number 2. You ever left an appointment and thought, Why didn't I ask about that thing? There's nothing worse than waiting for an appointment for months, trying to figure it out. You get there and then you forget. You forget what to ask. So, what we like to do is how do we use ChatGPT as our friend who can help us remember and help us set up what's going to happen in advance. So this prompt I love because it's great. You can do it for yourself. You can do it for a loved one. But I have an appointment about, tingling in my toes when I wake up. Help me prepare. What symptoms should I track before I go? What do I need to know? What questions should I ask? How do I organize my thoughts? So let's pull that here. I have tingling. And we have a bunch of these. I have an appointment with my 3-year-old daughter's pediatrician. She's been having meltdowns, or my first appointment with a therapist. You really can use this however you want, but let's try it here. You can use the same chat, just to name. If you're working with a GPT, you can use the same chat, or you can make a new one. So here, it's going to break this down because we told it, keep it organized, keep it printable. You may print it, but you may just write it down. You can screenshot it on your phone. I also want to note that we'll try this on the next one, that for ChatGPT, you can talk to it. So you can, this button here lets you dictate. So sometimes I might not want to type this all out. I may want to just say it. You can dictate and it will take your voice and transcribe it into words. And you can just put it in there. Here are my favorite things, right? When we look at this for this annual physical, this one is for someone who's 72. Symptoms to track, right? And we're concerned about memory and knee pain. When the symptoms started, what you forgot, how often it happens. For my knee, which knee hurts, pain level. And then here are some questions that you might want to ask your doctor. Are my memory changes normal, or we need to investigate? Should we do a memory screening? And here are some suggested blood tests. Again, this is made to be an example. What I would do after this is maybe copy this and say, why would we take these blood tests for memory? Tell me more about it. I might go someplace else and research, but this is a great way to get started. And then more questions, what screenings, medical history to mention. So I really like the prompts, but like even if you said it before, repeat it, right? If you have a family history of dementia, if you had any falls, anything around, the knees, repeat. It gives you the prompts and the things to remember. And then here's my favorite thing that if you don't leave with anything, please leave with this. ChatGPT is great with saying all the things that you're feeling and asking it to help you describe it in a way that your doctor will receive. We had it earlier in the chat, but here it gives you this little algorithm, the 4 S's. So start, situation, severity, and stuff you've tried. So I noticed this about 6 months. I forget appointments unless I write them down. It's not every day, maybe 3 to 4 times a week. And I tried sleeping, but it's still happening. I tried sleeping more. This is my favorite way. Sometimes we have a lot of things. If you've been there, please let me know. We're feeling a lot of things. It's my knee, it's my back, it's my everything else. Our physicians sometimes don't have a lot of time to chat. They're 5 minutes to the appointment. Oftentimes we can't communicate, I think, as fast as we might want to get our point across. And so want to be able to articulate and share and get our points across as fast as we can, so that we can be heard, understood, but also we're honoring everyone's time. Any questions here or thoughts here? Would you try this? Do you feel like this might be helpful? We're going to send you all of these prompts afterwards, so excited for that. The other way that we like to use our chat besties, this to research. So if you are like me, and this is a personal one, this is what you're going to do so that you're not Googling and spiraling into a panic and then texting whoever you text at 3 in the morning. So for research, we use this prompt. My doctor recommended XXX for this. What is it? How does it work? What are the benefits? What are the risks? What questions do I ask my doctor about my situation? And then what are some credible sources to read more to keep it balanced? not scary, and not sugar-coated. Again, these are the inputs. We're telling we'll call it a chat GPT or our AI, what we want to hear and how we want to hear it. And hoping that it, right, and telling it to tell us what we need so that then we can use that as a data point to then make a decision. So let's try that out. I'm going to do something different on this one because what we'll do is we'll just do a new chat. Let's try this for our kid, if you have kids or if you know kids. In this project, I'm just going to do a new chat instead of the same one, and we'll put it in there. So my child's doctor recommended trying Adderall for my 10-year-old son's ADHD. I'm worried about giving him a stimulant because at a young age, because his grades are suffering and he's struggling socially. So give me what it is in plain language, how it works in children, common benefits and risks for kids, questions to ask the doctor about my child's situation, and then credible sources for me to read more. Keep it balanced. I don't want it to be scary. I don't want it to be sugar-coated. I want to understand what the alternatives are. Now, you can change this, again, as much this one in particular because it's about children. We just added for kids and for children, but you can copy and paste the prompt however. And so here's what it says. Here's what Adderall is in plain language. It's a stimulant medication that helps many kids and adults with ADHD. It's a blend of two medicines, right? And it boosts certain brain chemicals. It's not meant to sedate kids or change their personality. Here's how it works. And what I really like about when you tell it to you like a bestie, it's, think of ADHD as having a lot of tabs open in the brain at once. The brain struggles to decide which tab matters right now. And Adderall works by increasing two chemicals. So this helps slow things down. Starts working. So it tells you a little bit of how it works. Common benefits, right? Some short-term side effects. And then the less common but important things to know, what might happen. Here it's like long-term safety. And then questions to ask the doctor. What should we ask? About the symptoms, about dosing, side effects, interactions, how to pause. And then here are some credible sources. Here's some alternatives. And what you can do after this prompt is, it gives you some suggestions. You could draft a checklist. It can do this, but you can be like, tell me more. I don't understand. Tell me more. And you can prompt your GPT to tell you what needs to happen next. All right. Our next prompt is how do we figure out these bills? It's designed to be this way. So if anyone here, have you received a medical bill that you didn't know what to do with? You didn't know what it was for? I have the billing codes. They're awful. They sure are. I've been there. Unfortunately for today, I was trying to find a bill so I could show you how to do it live, but we'll use the prompt that we have. But one of the best things about this is if you have insurance or you get the long paper, and we have some examples, we can ask ChatGPT to make this easier to understand. One of the ways that we'll do it is with this prompt. I got a bill for blank, blank, blank after this visit. Here's what it says. Help me understand what it's for. Look for anything that looks wrong or inflated. And then my favorite, number 3, draft a polite letter to question the charges. So if these charges don't make sense, it starts the process for you to figure it out. And then know what to ask the billing department, if I'm on blank insurance, if that matters. The best part about this is that you can upload photos into ChatGPT, or you can copy and paste it. You can do the same thing for Claude, but just make sure that you redact the information, and that you take a Sharpie. And so unfortunately today I couldn't pull out the bill that I wanted to. But what I would do is I would take a Sharpie. You cover, if you need to take a photo of it, if you want to make it digital, take a Sharpie and cross out anything that has identifiable information. So my name, my address, any member ID numbers, anything that is tied to personal information, literally color in with a Sharpie. I find that to be the safest way than editing things, so sometimes it won't work. But when you have your paper that's all scratched out, then you can take a photo of that and put it into your GPT. So we're gonna try this in the written form, but we'll see what it looks like. So we'll see, let's see. I got a medical bill. Let's put it in okay, so here I got a medical bill for $890 after taking my 5-year-old to urgent care for a possible ear infection. Here's what it says. Help me understand what each charge is for. Spot anything that looks wrong or inflated because the prescription was only $10 when I went to go pick it up, and draft a letter to question the charges. This one just want to name that you don't want to just write letters to write letters. That would be annoying for everyone, for you writing it and for the people receiving it. But this is a great way to figure out what you have. Sometimes you might get a bill that you can't afford and it's just too much, and it might be a correct bill, but you can't afford it. So in this case, we would shift the prompt to say, help me write a letter asking for support or financial support, compassionate care as it's called, to help figure out how to pay this. We're going to do another session just on billing and letters and figuring that out. So please look forward to that. This is just a little teaser. But here it is. So what each charge likely means, right? This is the basic fee, the facility fee. So it covers, the rent for the clinic that you're visiting, ear examination. And so all of these are matched, again, in our next session about billing and ChatGPT for medical bills. Everything that happens at a clinic or at a visit has a code. And so likely, and what ends up happening is everything you do gets put into the system, everything gets coded, and then that's what generates the bill. Think of it as like going to the supermarket and you scan everything, beep, beep, beep. Everything that happens at a doctor's visit, even though they're not scanning you, maybe not yet, has a code that's getting billed and rung up. Sometimes the codes are batched all in one, so I might pick one and it might bill more. So just to name that, that's kind of what's happening here, and our AI is helping us see what those itemized things are. Here's a good example where that should be a part of the general visit, not a separate fee. Here, depending on what state you're in, what insurance you have, we can look up rates and see what's happening there. Want to note that Medicaid and Medicare publish their rates, what they pay for every service every year online through CMS website. And so that stuff is publicly available, and you can tell ChatGPT or your Claude or whoever it is, hey, look at the CMS rates, and that can be a really good resource to reference. And it already has some of that in the system from its learning. Here's something about the strep test, so why it might be charged this way. Again, basing on the usual Medicaid rate to the extent that that's what you're using. And then amoxicillin prescription. This is a really fun one. And for an example, clinics don't usually bill for the medication, especially if you're getting it in a pharmacy, right? So there might be something to note here. Maybe they put in that they were going to give you a prescription and it billed you for dispensing it at the clinic versus you filling that at the pharmacy. So sometimes it's just great just to run these things through and see what you're being charged for versus what's actually happening. And then here's like just some red flags on what to look for and some notes. And then here's a little letter that says, hey, my child did not receive this medication on site. My understanding of this is included. Remember that AI makes mistakes, so please verify this. And this is an opinion not meant to be a copy and paste. That's probably one of the biggest things that we see, that we just kind of copy and paste everything. So really meant to be looked through, see what makes sense, see what doesn't. And then here's some questions that you can use to ask the billing department. You can ask about corrections. You can ask about financial support or financial aid. And then, you can keep on having this conversation with your AI. All right, we're in the home stretch. Prompt number 5, you don't have to health alone. At Radical Health, this is probably the most important thing for us when we think about, the future of health and what that looks like. We love the idea of tech, but we also know that tech isn't the end all be all. So this prompt, while AI is useful, real humans, we believe, are more useful. It's your neighbor, right, who's been through something and has been through what you've been through. Your cousin who can just sit with you and listen. Your friend who might go with you to the appointments and bring you something to drink. So the hardest part sometimes isn't wanting the connection. I think that all sits within us, but it's figuring out or knowing how to get the connection and knowing what to say. How do you have conversations about your health without it being weird or awkward? And so this prompt in particular helps you to find the words to start some conversations, discover where people are in your neighborhood, locate some support groups. Spoiler alert, you can always join Radical Health, but really also meant to give you some ideas to start your own circle if nothing exists. Because the real truth of it all is technology, again, is a tool, but we really believe that people and community are the answers. So let's see what this looks like in action. Okay. So again, every time you can keep one chat going or you can make a new chat. You can talk using dictate, this button here. You can use a voice mode, which actually you can have a conversation with the AI. We'll spend more time on that on the next one, like enhanced tools, and on our next one we'll do that. But here we're saying that my mom is dealing with early dementia, and I want to help her connect with real people. Help me write conversation starters that I can use to help her talk with her neighbors, her church friends, and the folks at her senior center. Help me find groups in Atlanta for her, and help me identify places where seniors naturally gather, get ideas for starting a caregiver support for our family. I want in-person connection, and it's telling the GPT to prioritize free, community-based, and culturally responsive options for Black elders. So here we are, right? Some conversation. Here are some prompts. Hi, this is something that if you're talking about your mom, hey, I live down the hall. I've been thinking it'd be nice to have coffee. Would you be interested? And I know these sound so simple, but sometimes it's scary to think about what this might be or start a conversation. We notice this in dating, right? It might be awkward to say, hey, nice sweater. But when we have a script and something that we can go to, these should be really easy to begin to build in-person connection. Here are some conversations, right? I've been helping my mom stay connected, and she'd love to join tea after service if they're in church or in a faith community. And so these are nice scripts to begin those in-person connections. Here is a scanning of local groups, specifically in Atlanta. And then after this, we have ideas, right, to do your own circle and support circles in the community. And so before we wrap up, we've covered a lot of prompts, a lot of things. I just want to talk about privacy. So while these I want you to know that these tools, anyone that anyone that you use, they do save your conversations. They don't sell your data to advertisers just yet, but they do use the conversations to improve their AI and their learning modules. So the rule that we like to go by is just keep it general. You can say I'm in my 50s with high blood pressure. You should never say, hi, I'm Ivelisse and I live at 123 Main Street and I take this medication. You never want to give all that information because it is identifiable. Come up with a fake persona when you use your GPT. Do whatever you need to do to keep a healthy distance between you and the GPT to remember that this is something that you want to keep some privacy. Think of it as like being also like in a coffee shop, right? If you wouldn't say it out loud in public, you wouldn't say it at the bank, then you don't want to type it into AI. We want you to really keep as much, maintain your privacy. And keep that to yourself. And then when not to use AI, stop. Let me be very, very clear. If you're having chest pain, do not ask ChatGPT, call 911. If you can't breathe, there's stroke, anything, suicidal thoughts, allergic reactions, anything that is a real health emergency, do not get on the computer. Call 911. Get help immediately. AI is for prep work, especially for your health. It's for understanding. It's for helping you to organize your thoughts when things can be overwhelming. It is not for emergency. It is not to diagnose you. It is not a replacement for a doctor. Or if you're in a crisis or a mental health emergency, please call a human always. And you're not alone. Right? You're not supposed to help alone, but you're not alone. Remember that AI is a tool, but people are the answers. The tech, again, can help you understand, organize, and prepare, but you really do need your community, your doctors, your support system, in-person care. And as we do that, we invite you to join us in some of these conversations. Please join our community, community.radical.com. Share what works, ask questions, support one another in there. Please join our Instagram where we'll share tips, community stories. And most importantly, we have a fellowship program happening where we teach you how to have these conversations. We teach you how to support your community. So apply for our fellowship. We have applications open until December 4th. It is a paid fellowship where you learn these tools and we pay you. And then you're going to get an email tomorrow with a recording of today. All of these printable prompts that you can use, links to resources, and a link to join our community. This is our friend Freddie, by the way. We really like him. He's great. And before you go, can you comment in the chat your commitment to do one thing. So whether it's after your next appointment, you're going to use one of the prompts, prompt one, prompt two, you're going to check for the bias in a response you get from your AI. You'll join our community or apply to our fellowship, or you'll teach this to someone else. Could be any of these that we have up here. But if you wouldn't mind chatting or commenting on what's the one thing you're going to do after all of this. And you don't have to do everything. We just need you to start somewhere, just one thing. And if not, we just want to remind you that no matter what health is to you, healthcare is for you. We know that in this world and in this time, healthcare is complicated, it's scary, it's lonely. The healthcare system hasn't been the best at supporting and encouraging and inviting folks, right, to really be a part of their healing. And at Radical Health, again, we really believe that no matter where you're coming from, no matter what your experiences are, there's a way for you to have health and health care and to do it in community. So thank you for joining us today. Thank you for allowing us to be a part of your journey. We want to continue to build and share. We invite you to join us on upcoming webinars where we learn more about AI, the ways that we can use it in specific contexts, and let us know what else could we be doing. We want to hear from you. We want to be connected with you. It has been my pleasure, our pleasure to spend this time with you. We look forward to seeing you again. If you have any questions or want to chat further, please shoot me an email, join our community, or hit us on social media, and we're happy to chat more. Thank you all so much. And thank you to the team that helped pull this together. Really appreciate it. Thank you.